These Nigerians have good reason to celebrate. Their community is about to be awarded for reaching an important landmark in improving their water and sanitation situation. They are also showing off their latrines to their neighboring communities to encourage them to do the same. The new hardware protects their environment and surface water sources from contamination. Before, they used open fields and the lush jungle to defecate. Today, thanks to support from UNICEF and the European Union, they have latrines, regularly wash their hands with soap, and have easily accessible clean water sources.
It is important because, you see, the health will, so it is said, and we are a completely agrarian society.
The chairman of this local government area in Osun State is here to encourage community leaders to secure total sanitation and award them for maintaining hygienic and safe villages.
Where we find people who are not as healthy, then they will not be able to do well on their farms. And once they cannot do work on their farmlands, their economic abilities or mainstay goes down, and there is some problem. And poverty becomes another problem. Then health becomes inclusive, which leads to death in early ages.
Achieving open defecation-free status is not only about putting in latrines and bars of soap, it's also about teaching families about simple but effective measures to maintain hygiene. And providing easy-to-reach safe water cuts down dramatically the amount of time women and girls fetch water. It makes hand washing that much easier too. Drama, song, and dance are used to hammer away at key messages on things like hand washing, which ensures that even the youngest children get introduced to good practices at the earliest possible age. The European Union provides the funding and UNICEF the technical support.
If we want to reduce under 5 mortality, we need to have access to clean drinking water. If we want to have under 5 mortality reduced, we need to ensure proper knowledge and skills on sanitation. With open defecation, you increase the risk of children having interaction with feces openly. In addition to that, the environment is not safe for them to play. If you don't have water for washing hands, you don't have soap, parents don't properly wash their hands and clean themselves before caring for the children. All of these comprehensively lead to deaths of children, and we need to stop that at the root.
Where we prevent, we help the community. So we are looking at the possibility of having a healthy community, and once we have a healthy community, then we are sure that the economic mainstay, which is agriculture, and which is majorly agriculture, will be boosted, and the people will get enough money.
There are now 21 communities in the state that have achieved open defecation-free status. The costs are low, and as long as community leaders commit to the scheme, deaths of young children due to bad water and sanitation could be dramatically reduced. The extra time on their hands from reduced sickness means more time for farming and other economic activities to improve their livelihoods. For UNICEF Television, this is Dee Dones.